Good afternoon, Mrs. Odell. My name's Tristas. I'm going to be your nurse today.
Hello,
Can you say your first and last name
Jennifer Odell,
and your birthday
11/16/80.
and what brings you to the doctor today?
Just a follow-up, and I need refills on some of the medicine.
Okay. I just want to let you know before I came in, I did wash my hands. I have on clean gloves, so I don't want you worrying about that.
Okay.
You appear very well kept today, appropriately dressed. You did take off your jacket earlier. I guess you're enjoying the snow?
I love the snow.
Okay. All right. Your gait appeared fine when I walked in behind you. You know, no problems there. Do you have any issues you feel with your ambulation?
No issues. I just had an appointment with the podiatrist. I have, what's that called on the bottom of my foot?
Plantar fasciitis?
That's it.
Oh,
Yes, I can
yeah.
remember that. Yeah.
That's a very common ailment.
Mhm.
Okay, and you're seeing a podiatrist for that, you
Mhm.
said? Okay. All right. Well, if you don't mind, I'm just going to take a quick look at you, do a head-to-toe assessment. But before then, I'd like to go over any health history you might have.
Okay. I had my gallbladder removed. I am diabetic. I have a history of supraventricular tachycardia. It's controlled with medicine. Diabetes would be better controlled with a better diet, but the medicine helps.
Okay. So you are well controlled with your SVT, with your medications? Okay. All right then. Well, I'm just going to start off and take a look at your scalp and your hair. Make sure there's no infestations, bumps, lesions, anything of the sort. Are you having any trouble with your scalp right now?
No, ma'am.
Okay. I'm going to palpate. Does any of this hurt? You just let me know if there's any pain or tenderness.
No, ma'am.
All right. I'm going to take a look at your face. Everything appears to be symmetrical. Can you smile for me? All right. How about stick out your tongue? Can you do your tongue side to side inside your jaw? All right. Very good. Very good. Give me just a second. I want you to close your eyes, and I'm going to do two things. The first is I'm going to run something down your face, and I want you to tell me where you feel this at, okay?
Okay. Right there.
All right. And one more time.
Right there.
Very good. Now I want you to see if you can tell me what I'm going to have you smell.
Okay. Smells like alcohol.
All right. Very good. Very good. Now I'm going to palpate your temporal arteries. I feel a very good strong pulse there. And then I'm just going to come on down. And now I'm feeling for your lymph nodes, your preauricular, and then your post. And we'll walk around back here to your occipital. Any pain or tenderness?
No, ma'am.
Submandibular.
Okay.
And your submental. Now I'd like to check for your supraclavicular. Is there any pain or tenderness?
No, ma'am.
Very good. I want to check your range of motion on your neck.
Okay.
If you look up, down, left, and right. And now if you could do a big circle for me. Excellent. I'm going to put some pressure on your shoulders, and if you could truck up against me. Very good. One more time. Excellent. I'm going to check for your trachea. Everything appears to be midline. No pain or tenderness? There's no swelling. Noted. And I have a glass of water over here. If you don't mind to take a drink for me, I just want to watch your swallowing. Very good. Next, I'd like to check out your eyes.
Okay.
I'm just going to look at your sclera and your conjunctiva. I don't see any redness or drainage, no jaundice. Do you have any problems with your eyes?
No.
I know you said you were diabetic. And you get checked yearly?
Yearly dilated eye exam.
Excellent, excellent. All right. Now I'm going to check for your pupils, see if they're equal and reactive in their accommodation, okay? I just want you to look straight into my light. Straight ahead for me. Very good. Very brisk. Excellent.
Sorry, my emotional support dog is with me today.
That's all right. I love dogs. Even better that he's your emotional support dog. All right. Now I'm going to do the 6 positions of gaze, okay? What I want you to do is not moving your head. I want you to follow my pen light with just your eyes, okay? Ready?
Mm-hmm.
Very good, very good. Now this is going to be a confrontation test. What I want you to do is when you can see my finger, you tell me when it comes into your peripheral vision, okay?
Okay. Yeah.
Very good. And again?
Okay.
Excellent, excellent. Now, holding this card about 6 inches in front of you, I want you to cover one eye and read me the first line, and then do your other eye.
Mental status assessment begins during the health history. How the patient responds to your questions gives clues to their orientation and memory.
Very good, very good. Now, what I would like for you to do is I have a line taped over here. I want you to walk heel to toe to that line and then turn around, and we're going to use the Snellen chart to check your vision that way also.
Okay.
All right, very good. Now covering one eye,
Okay.
tell me what's the first line that you can see clearly.
PECFD.
Okay, and covering the other eye?
PECFD.
Very good. Looks like you have 20/40 vision in both of your eyes.
Yeah, that's without my corrective lenses. So
Okay,
yeah, with them I see a little bit better.
excellent.
You want me to sit back down?
Yes, if you'll have a seat for me.
Okay.
Lastly, I would like for you to look laterally for me, down and laterally.
Okay.
And how about just side to side? Very good, very good. All right, next I'm going to inspect your ears.
Okay.
I'm just looking for any redness, swelling, drainage. I see here that you have 2 piercings and 1 cartilage over here. Do you have any trouble with your ears?
No, ma'am.
They appear symmetrical. All right. Now, I'm going to take my otoscope and I'm going to pull the pin up and back and I'm going to look in there. And I'm just looking for any wax, drainage, redness, and to check and see that your tympanic membrane is a pearly gray, okay?
Okay.
Very good. Yep, both are nice pearly gray. Not a lot of wax in there. Now I'd like to do what's called the whisper test. I'm going to whisper one word. And I'd like you to tell me what that word is.
Okay. Lights. Narwhal.
Excellent, excellent.
You like narwhals?
Narwhals are my favorite. Not many people know what narwhals are, really. All right. Now I would like to check your nose. Have you ever had your nose broken?
Many times.
Many times. I can tell you. Your septum's deviated slightly there to the left.
Mm-hmm. I played sports.
Played sports. Took an elbow to the nose?
Multiple times.
Multiple times. Okay.
That's awful.
Oh, okay. Well, I'm going now to check your mucosa, your turbinates, and your membranes. Nice and pink. Membranes look good. Are you having any problems with your nose right now?
No.
Okay, excellent. And if you don't mind, I'd like to check out your mouth. Just make sure we don't have any lesions or sores, anything of the sort in there. Very good. Your soft palate looks good. I don't know any lesions. No missing teeth. Tongue's nice and pink. Can you stick out your tongue and say ah? Ah. Your uvula moves very well. All right, now I'm going to check for your gag reflex.
Okay.
You stick out your tongue for me. Very good, very good. And now moving on, I'm going to inspect your back and your lungs.
Okay. Got enough room?
Yeah, you can scoot up just a smidge. All right. Now I want you to lean forward for me just a little bit. Take a big deep breath in and out. I'm just checking for equal expansion. All right, and again. Very good. And one more time. Excellent. Now, do you have a history of scoliosis?
No.
I want you to tell me while I'm palpating if you feel any pain or tenderness.
No.
Okay. Nothing down here?
No.
All right. How about when I push here?
No.
Very good. Now I'm going to take a listen to your lungs.
Okay.
Big deep breath in and out. And again. Very good. Again. And one more time. Very good. Everything sounds clear back there, all 4 lobes. Now I'm just going to do the same thing in the front. Big deep breath in and out. Very good. One more time. Now if you just breathe normally. Very good, very good. Now, I know you said you had a history of the SVT and that's controlled with medication.
Mm-hmm.
Now, I'm just going to continue on with my cardio assessment. If I can look at your hands here. I'm just checking your nails for any clubbing. Calf refills less than 2 seconds. That's exactly what we want. You drink enough water?
I drink a lot of water.
I'm just going to check your skin turgor here. Oh, yeah, very good. And I'd like to check it here, too, if that's all right. Excellent skin turgor. I'm going to palpate your PMI, which is the point of maximum impulse, which is where you can feel the heartbeat the strongest. This is in the 5th intercostal space, mid-clavicular line. Very good. Nice, strong pulse rate. Now I'm going to take a listen to your heart. I'm going to auscultate with my stethoscope. I'm going to listen for the aortic, the pulmonic, the tricuspid, and the mitral sounds. Very good. S1 and S2 are clearly. I didn't note any S3 or S4 sounds, which is great.
What's S1 and S2 mean?
Those are extra heart sounds.
S1 and S2?
Oh, I'm sorry.
You said I had those.
You had S1 and S2, which is the loved up.
Okay, good.
And then S3 and S4 are extra heart sounds.
And I didn't have that.
You did not have any extra heart sounds. Yes.
So everything was normal?
Everything was normal, yes. Now I would like to check your pulses. Good, strong pulse. I'm going to check here also. You can also check her femoral pulse, which is located right here. I don't feel any need to do that right now.
Okay.
But just so you're aware. And if you could prop your feet up here, I'm going to check for your popliteal pulse. And actually, I'm going to push this up so I can feel a little bit better, if that's okay.
Sure.
Very good. And I notice you don't have any hair on your legs. It looks like you've recently shaved. But when you do, is the hair evenly distributed?
Mm-hmm.
Very good. Check your pulses here. And then on top of your feet here for your dorsalis pedis. I do feel pulses in all the areas. And I notice you don't have any swelling, no edema, no redness. The skin on your legs looks very, very good. Now, do you go to the gynecologist yearly?
I do.
You do, okay. And so, do you have a mammogram every year?
I just turned 40, so I've never had one.
Now's the time. This is the year.
Mm-hmm.
All right. Well, do you do self-breast exams?
I do.
You do. And how do you do those?
With my fingers, I start in my armpit and I work around to my breast, and I do it laterally across my entire breast.
Excellent, excellent. And what time of the month do you do those?
At the end of my monthly cycle.
And is that pretty regular?
Mm-hmm.
Okay. Well, I just want to demonstrate for you. That way, I know for a fact that you're doing it properly, because that's something important we don't want to miss.
Sure.
Now, if you don't mind to go ahead and lay down there for me. It's very important to put one arm up above and over your head, and I want you to start in your armpit.
Okay.
And I want you to walk with your fingers and see if you feel any lumps, bumps, anything unusual. Walk your fingers over to your breast, and then, just as you said, go up and down, not missing any areas of the breast until you've done the entire breast.
Okay.
And we are going to do that every month after your period, and we're going to make sure to do both breasts.
Gotcha.
All right. Well, since you're already laying down, if you don't mind, I'll just like to take a look at your abdomen.
Okay.
If you don't mind, I'm going to pull up your shirt. Okay?
Mm-hmm.
All right. Well, your skin looks fine. I don't notice any bruising, any bumps, lumps, or any redness to your abdomen. Symmetrical. Color looks good. I'm going to auscultate for some bowel sounds with my stethoscope here. I'm going to check all 4 quadrants. Very good. Now I'm just going to percuss your abdomen. Okay. You let me know if there's any pain.
Sounds like a hollow log.
It does. Or a watermelon, I feel like. You ever thump a watermelon to check to see if it's any good? Everything sounds good in your abdomen. Now I'm just going to lightly palpate. And once again, if you have any pain or tenderness, I want you to let me know.
I'm good.
Okay. Now I'm going to do a deep palpation.
Okay.
Once again, if you feel anything.
Okay.
Does it hurt when I release?
Mm.
Very good. That's checking for rebound tenderness. Very good that you don't have that. All right. If you'd like to need some help setting up.
Oh, I got it.
Okay. Now I'm going to give you 4 words to remember, okay? And
Okay.
then I'm going to ask you later on to remember those words.
Okay, good luck.
Blue, tree, car, horse.
Blue tree, car, horse.
All right. Now moving on, I'm going to do a neuromuscular exam, okay? Can you tell me who the President of the United States is?
Donald Trump.
And you've already told me your birthday. Let's see, what else can I ask you? Do you know who the president was the year you were born?
Jimmy Carter.
Very good, very good. Okay, let's see. I want to check your range of motion.
Okay.
We've already checked your neck. Now I want you to stick your arms out straight for me. And can you bring it at your elbow? Excellent. How about in a circle? Can you reach in behind your back? Very good, very good. Oh, okay. Now I'd like to check for sensations. And you already have your socks and shoes off, so that's good. Alright, so I want you to close your eyes. And then I want you to tell me what you're feeling is dull, soft, or sharp.
Okay.
Ready?
Dull.
Very good.
Sharp.
Alright.
Soft.
Okay, now I'm going to do this other foot.
Dull. Sharp. Soft. It's tickling, sorry.
Alright, I'm going to, can you do finger to finger like this for me? And how about finger to nose? Now, if you take one foot and put your heel of your foot and run it down each shin, both sides. Very good, very good. And if you can grip my hands, very good. Your grips are nice and strong and equal. I'd like to check your reflexes.
Oh, let me turn this way for you. Do you need me to cross my legs?
If you want to, yeah, that'd be fine.
Okay.
Very good. Now the other side. Very good. I'd like to do the same on your arm. Oh, and one more time over here. Okay, very good. Now, do you remember those 4 words that I gave you?
Blue, tree, car, horse.
Excellent, excellent. And see, you thought you weren't going to remember them. That concludes my exam for the day. I've done a full head-to-toe assessment. You seem to be doing fine.
Okay.
Do you have any other concerns for me before the doctor comes in?
With that, what did you say that was on the bottom of my feet? That
Plantar
hurts?
fasciitis?
Yeah.
Mm-hmm.
I've been going to physical therapy for that.
Okay.
So, they always told me to make sure, especially with diabetes, make sure that I have good range of motion in my legs.
Oh, okay, okay. I can certainly check that for you.
Sure.
All right, give me this leg first. And can you point your toes down?
Yep.
And how about back towards your shins? Excellent. Now, can you bend at your knee? Okay, we're going to do the same over here. All right, knees working fine. So point your toes towards me and then back again. All right, everything seems to be doing good. You keep on doing your physical therapy, and I think everything will be fine.
All right.
All right, it's been a pleasure meeting you, and I'll send the doctor right on in.
All right. Thank you, ma'am.
You're welcome.